I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. The minutes of the previous meeting were distributed with your packets, the September 17th meeting. I'll entertain a motion at this time to approve the minutes.
So moved.
I second.
Second. Motion has been made and seconded. Any comments on the minutes, additions, deletions? Anything? All in favor of approving the minutes as submitted, say aye. Aye. Any contraries? Hearing none, the minutes are approved as submitted. We have a few announcements before we get to the health officer's report and his announcements. October is Breast Cancer Awareness Month, and that's an important month for us in public health, and as well as everyone concerned, and I know we'll all do our part in helping to combat this disease. Last month, Dr. George Avedian and I, Dr. George Avedian is the senior medical advisor to the Delaware County Council. He and I recorded a program on West Nile virus. It is available at the Township's website, and it's periodically available on the Township's cable channel. In addition, Ms. Wishner has an announcement about Project REACH.
So this Wednesday, October 17th, from 7 to 9:30, REACH is having its first event of this school year. And where is it? Radnor High School, 7 to 9:30. And this first event, which they've done before, is a speak up. So it's really just to kind of elicit concerns from parents and other community members to see sort of what programming they should plan for the coming year. So just some of the things they're indicating are self-worth, self-image, stress and anxiety, parent-teen relationships, bullying, sex and pressure, goal setting, and alcohol and drugs. Certainly could be other issues, but I encourage people to go, and you know, you'll hear other parents, you'll have a chance to express yourself as well. So again, this Wednesday, October 17th, Radnor High School, 7 to 9:30. And it's funded by the Radnor Educational Foundation. For more information, you can go to Speak Up, SPEAKUP, at speakup.org, or call Ann Bernicker at 610-519-9600.
Thank you for that. One additional announcement. On Wednesday, October 24th, 2012, the Delaware County District Attorney's Office, hosted by District Attorney Jack Whalen, will be conducting a Safe Schools Summit. There will be presentations on bullying prevention and awareness, realities of prescription drug abuse. There will be an FBI presentation on concealed weapons, and there will be a session on anti-violence resources and best practices. Registration for this event is required, and for more information, you may email Emily H. Harris at her email address is Harris, Harrise, at county, that's co.delaware.pa.us. I'll repeat that. Harris, Harrise, at co.delaware.pa.us. That concludes those announcements. Mr. Taltone, I understand we have a couple of home quarantine issues that you are going to present at this time.
We do, sir. Good afternoon. The first request for home quarantine is from Mr. and Mrs. Paul and Sharon Bergermeyer. I won't read their address out for the public, but they are residents of Radnor Township. They have a cat by the name of White Sox who has suffered a wound of unknown origin. I had the opportunity to go out to their property on last Friday and look at the location in their home where they would keep White Sox if this board so chose to grant their petition. They are here tonight. I don't know if they want to speak, but they are here tonight.
If either of you would like to speak, please come up to the microphone here. Introduce yourself, please.
I am Sharon Bergmeyer. As a professional, I'm a chemistry professor at Bryn Mawr College. I could tell you at least the story of what happened to poor White Sox. On Saturday, September the 30th, I noticed she was just sitting very quietly instead of running around the yard and had an odd lump on her leg. So when I brought her to our vet the following week, I think it was maybe October the 2nd, she identified that there were bite wounds, actually 2 different bite wounds in White Sox, but that also, unfortunately, White Sox rabies vaccination had lapsed like August, a couple months before. So, she informed me that she had to inform you that White Sox was bitten by an unknown animal, and there was risk of rabies being outside of her normal vaccination.
Thank you.
Mr. Hayes, and I did visit the home, looked at the location where they wanted to keep it. I went through step by step, Chapter 115, Section 6, the quarantine requirements. They have Mrs. Bergermeyer is going to be the primary care person. Am I correct?
Yes.
You are the primary care person. I do believe that they can sufficiently and adequately quarantine at home, and it's my recommendation that if the board approves that, they can do it.
Okay, are there any questions that anyone has of White Sox's owners or Mr. Taltone? I'll entertain a motion to approve the home quarantining then of White Sox.
I'll make the motion to approve home quarantine.
The motion has been made and seconded. All those in favor say aye. Aye.
Aye.
Any contraries? The motion is approved. Thank you.
Thank you.
Good luck.
Mr. Hazen, the second one is one that happened back in July. And this particular cat, likewise, suffered a wound of unknown origin and was not current with his rabies shots. Since that time, he has been, or she has been, I'm not sure if it was a he or she, has been quarantined at a local veterinary hospital. The owners have, I just received a letter today and a call, have requested permission to home quarantine. Now, I have not been to the property yet to take a look at where they want to keep it. I'd like to be able to do that before they release it. If it's the board's pleasure, you can base that approval on my inspection.
So my understanding is that you have not yet made a home inspection and that you're asking us to approve the home quarantining contingent upon that inspection.
That's correct, sir.
Okay. Are there any questions for Mr. Taltone? Hearing none, I'll ask for...
I just have one question. So, like how long a time period has elapsed with all this?
Well, the cat has been in quarantine since July 17th. And I'm assuming, I'm just making the assumption that that's pretty expensive to do that on a daily basis, and it's been like 3 months. So I'm assuming that they not only miss it, but it's getting expensive. But if the board approves, then I'll do the inspection. If it meets the requirement, then I'll approve it. If not, then I won't.
Any other questions at this time? We have a motion, I might as well make it then, to approve the home quarantining of the cat mentioned in, does it have a name, Mr. Taltone?
I'm sure he does. I just got to find in my notes.
Well, that's all right. The motion will say that we approve the home quarantining of the cat just mentioned in your report, contingent upon your home inspection, and if that passes muster, then the motion will stand. If it does not, you will report back to me immediately so that we'll know where we stand with that.
That's correct.
Do I have a second to that? Thank you. Any other questions, comments? All in favor, say aye.
Aye.
Any contraries? Motion is approved. Before we go on to any further announcements, I'd like to take this opportunity. It's a great pleasure to me to introduce to the board our third Radnor High School intern. Her name is Claudia Cardamone. She's a Radnor High School sophomore, and welcome, Ms. Cardamone. Would you like to say anything about yourself, what your interests are, and what brings you here?
So I'm Claudia Cardamone, as you said, and I'm a sophomore at Radnor High School. I row, so I do crew, and I also play drums in the band.
You have a specific, I don't mean to put you on the spot, do you have a specific interest in public health or health matters in general, other than keeping yourself healthy and fit?
Well, my guidance counselor actually just told me about this, and I thought it seemed interesting. And like prior, I've never like specifically taken interest, but now it interests me, so now I'm here.
That's great. We hope that we will generate an interest in public health for you. Dr. Leader, thank you for recruiting Ms. Cardamone. Do you have anything to add at this time?
Not really, except I kind of had a discussion that Mr. Taltone and I had about trying to make sure that the intern has an opportunity to go out on a safety inspection round with Mr. Taltone. I mentioned that Dr. Donato had done this in the past and said it's highly valuable and worthwhile. And I was thinking that in the past with the previous student interns, we just kind of left it a little informal to check in with this, and it was hard to work out because it's usually during school hours. But I was thinking if we were interested, I could or some way approach the guidance counselor again to see if we could make this more a formal part of something to do, where the guidance counselor could approve a half day of inspection rounding or something to make it more of a valuable experience.
That sounds very worthwhile doing. And again, as I said at the last meeting, I also have the company, Mr. Taltone, in his rounds, and it's a very informative experience. Any other comments or questions before we move on? All right, Mr. Taltone, the floor is again yours.
Again, good afternoon, Board. My report for the month of September is in your packet. I believe it was something like 27 inspections, food safety. And for the moment, I just misplaced it. Send it somewhere else. Well, there was 27 food safety inspections. I think we did 11 of those inspections were with the Wayne Fall Festival. We had quite a few quality of life issues that range from a person with hoarding. We had a death of a person and a dog, where we had to do some cleanup there. I also wanted to mention to the board what Mr. Hazen already did, the district attorney's Safe School Summit. That is October the 24th, 2012. I think that might be very beneficial. Last month, we had the National Take Back Initiative, which was to get prescription drugs that are no longer needed, disposed of properly. Radnor Township was able to get 54.9 pounds collected in the township, which I thought were good. As Mr. Hazen noted earlier, Dr. Avidian has a, I believe he mentioned it, has a van that he's sort of our Dr. Oz. He's working with, I think it's Blue Cross. And I've been asked to ask him about bringing that van here to Radnor. So he is working on that idea and seeing the availability of doing just that. So we should know in the very near future whether or not that van is going to be available, or he can come to Radnor with that. Also, the interview that Dr. Avidian and Mr. Hazen did for the Radnor TV, I watched it, and everyone who hasn't may want to do so. It's very informative. It's very good. And so ends my report.
Would you, I know we did discuss the van, the Independence Blue Cross van that is calling in other locations in Delaware County, and I'm glad we're following up on trying to get it for Radnor Township. Would you refresh our memories as to what that van is doing?
Yeah, I'm going to read a little bit of it. Delaware County Senior Medical Advisor will literally be making rounds to various communities in a giant, colorful wellness van, delivering a healthy dose of preventive health care information to residents. Dr. George Avidian, a Delaware County Council, are participating with Independent Blue Cross to launch a Wellness on Wheels initiative where he will visit libraries, senior centers, and other community facilities to present information on a wide variety of public health topics. Called Ask the Doctor, the program is part of a county overall effort to educate residents about various public health issues from vaccinations to healthy lifestyles. What do my cholesterol numbers mean? Are there natural ways to reduce high blood pressure? What does it mean to be pre-diabetic? These are just a few of the most commonly asked medical questions when people talk to medical experts. So he's basically going to go around and try to answer questions that people have.
Thank you. Are there any, does that conclude your report then, Mr. Thompson?
That does complete my report.
Any questions or comments on the report? Hearing none, we'll move along to old business. The first item under old business is teen health issues, and that refers to the poster project that our previous intern, Alexa Lee, was working on. Mr. Kane is here tonight from the Radnor Township School District. He's our liaison to the district, and he has been good enough to produce the posters. And Dr. Leader, he and I will be meeting informally after the meeting is over to discuss next steps with regard to these posters. Any questions about that? Okay. The Alliance for Safe Kids, which hosts a fall and a spring program, did meet last Thursday at 11 o'clock at the Radnor High School. Unfortunately, I was unable to attend, so I'm awaiting the minutes of that meeting, and we'll report on them too. In fact, I get them via email, and I may just forward them on to the members of this board for your review and information. The Environmental Advisory Council has had representation from this board. Kelly Doyle, who's a member of the board, has been our representative. She's not here tonight. I did not hear from her in terms of whether or not she would be able to attend tonight, but I will be getting in touch with her. I have a suspicion that due to a promotion, for her, which is a good thing, that occurred near in the late spring, may prevent her from at least carrying out that part of her responsibilities as a member of the board. So pending my conversation with Ms. Doyle, I'll ask members of this board to think about whether they might be interested in representing us to the EAC for the coming year. The EAC meets at about 6 o'clock, I think. Yeah, I think that's correct, on the third Thursday of each month. Okay. Let me, before I get on to the animal control ordinance topic on our agenda, the College of Physicians of Philadelphia recently hosted a symposium on the potential health effects of hydraulic fracturing. I was due to attend but was unable to at the last minute, but Ms. Wishner did attend, and I'm wondering if you'd be good enough to give us a summary of what they talked about.
Sure. I mean, it was a terrific presentation. They had three perspectives represented. One was, the theme of it was, what's the state of the research? What do we know? What don't we know? And why, actually, do we know or not know certain things? So they had two researchers who are involved in animal health and research, and I gather that Cornell University has kind of made it a focus of theirs to look at animals possibly affected by fracking. And one of the people's connected with Cornell, they, for example, made it clear that they are interested in doing autopsies of animals that are exposed to chemical spills in the area. They had a physician who's an administrator with Geisinger, and Geisinger's catchment area essentially overlaps with the fracking area, and so they have gotten a whole national committee of experts to advise them on a very large epidemiologic study of their patients, looking at health data. So they're not looking at they're sort of limited in what they can look at environmentally, just funding-wise, but they will be looking at the effects on people. And then there was a physician from the area, so she both lives in the area, and also she has patients that include workers who work in the fracking industry, as well as just people affected by it. And I guess some of the themes that came up from all the people in general, well, first of all, they all agreed we really don't know that much. The science is very minimal, and part of the reason for that is that there's not much funding for it. They drew a comparison between in the pharmaceutical industry. Before a chemical is released, the pharmaceutical industry has extensive testing that they have to do, and they have to prove safety, efficacy, and of those have to be equal or better to than pre-existing products, whereas for the chemicals used in fracking, no such burden on the industry exists. So as there's a view that the chemicals are some of the proprietary information, so it can be difficult even finding out what's there, and for a lot of them, finding safe and effective levels. So if you want to say, okay, this level is going to be what we view as safe in meat, for example, that will be sold. And for example, Pennsylvania, because for many of these chemicals, the basic research has not been done to determine safe levels in meat or plants, Pennsylvania has said, well, if there's no science supporting a safe level, then we have to say any level is fine. New York State, on the other hand, as they pointed out, literally made up levels so that at least they would have some ceiling to say, you can't distribute animal products, that are of this level. So the fact that there is, not a lot of the basic science that we need, and yet there is not funding to do the basic science in a lot of areas is a real issue. Secondly, just in terms of the area geographically, it's a lot of it is rolling hills, and so that a lot of fracking may not be visible. except in the winter it becomes more visible as there are fewer leaves on the trees. And I guess another common theme was that we're all downwind, we're all downstream, that the releases of steam containing chemicals and the water that gets into the aquifers and the streams, that they had an example of one area where there's fracking going on, and it's literally right next to a farm that bills itself as an organic farm. And so that kind of idea that, and the way, another very common theme was the amount of stress that this has caused in lots of different communities, because people are making decisions that don't affect just them. They affect their neighbors, they affect their communities. As, an example of, noise, just to start with that, the amount of stress that that's causing, the amount of noise. And, I think you've probably heard things about the roads and about how there's a lot of, I recently drove out to Pittsburgh and could see myself a tremendous amount of traffic of trucks with like big pipes of things that looked likely were being used for fracking. But anyway, a lot of rural roads have been really torn up because of the amount of truck traffic. Another issue that came up that I was not aware of was that on the one hand, Pennsylvania likes to promote the fact that we have some very good regulations on the books, but how it turns out in the real world is that by the time it gets down to the subcontractors who are carrying out a lot of the work, that there may be a combination of not being aware of what the regulations are, workers not having the right equipment to protect themselves in the work that they're doing. Not only are there chemicals being aerosolized, but there's a lot of sand. So the physician in the area was saying that she, thinks they're laying the groundwork for probably silicosis in the future because the amount of sand that workers are inhaling. And also that water, there are regulations about water supposed to be trucked, and there's certain specific places and ways in which it can be disposed of. But the two people from the animal researchers, personally, showed photographs of a truck that had just dumped wastewater on a road to use as dust control, which is explicitly something they're not supposed to do. That wastewater is not supposed to be used for dust control. And yet here these rural roads are being sort of ground up. It's very dusty. And so, as they said when they showed the photograph, they said the thing that you can't see in this photograph is the smell of just, the smell. One other thing, I'm sure Dr. Donato, you're aware of this, but I wasn't thinking of it, is that the way animals are farmed is that the herds are kept separate. They are kept in separate fields and kept separately, so that they are able to do certain kinds of epidemiologic research, because if a particular herd is exposed, they can track, what happened in that herd, compare it to, blood levels, tissue levels, et cetera, of other herds that might not have drunk that particular water or had that particular, exposure, so that sort of going to herd immunity and, all those issues about herds, that was sort of a interesting thing. I think those were some of the main things that came up. I guess just the other thing the physician spoke of, she talked about how in many areas people are not buying produce and meat and dairy products from the area because they smell the smells, they see the noise, they see animals having reproductive issues. So although not sort of based on epidemiology, she was pointing this out as a very tragic aspect of, and she herself just told an interesting personal story. She was from South Dakota. She went home this summer, saw, a very dry, drought area. So she comes back to Pennsylvania, these like really rolling green hills, and was just talking about how, we can't take it for granted, this incredible agricultural area that we have, where we have water, we have, you know, a great agricultural climate that doesn't exist everywhere in the country, and certainly not everywhere in the world, and that it's really a very precious resource that we need to be careful of. But the Geisinger, you know, in terms of the environmental sampling, I mean, that's another sort of black hole in terms of, because you could say, well, can't we at least take the environmental samples and store them and have them available? But then that requires funding to collect them, to store them. Air quality sampling in particular, you need like 3 to 5 miles around where you want to be sampling the air. So, you know, the Geisinger study is going to do some of this. But even for that study, the administrator was very political and talked about how, you know, he has this National Committee of Experts. On the other hand, they have not gotten funding from the National Institute of Health, the Institute of Medicine. I mean, it's essentially at the moment funded by the Geisinger Foundation, even though it has these, you know, really, you know, important national health implications. So again, even for that study, which is, you know, very well designed, is really going to yield some great data. You know, there's real challenges in doing it, and in particular doing the environmental health piece. So, you know, it was a good presentation, and certainly there's a lot of heat on the, you know, fracking, of course, the desire for cheaper energy, and at the same time a desire to protect the environment, and especially long-term, you know, potential impacts on animal. And it was good to think about in terms of animal health, plant health, soil health, air health, you know, water health. So, you know, really looking at it in a very multifaceted way. So it certainly raised, you know, they did not provide a lot of answers, and yet there is science in process to try and provide some of those answers, and also, you know, real concerns in terms of not just, I think the point about not having, you know, levels that are viewed as safe, and so either saying, okay, well, anything's safe, I guess, or saying, okay, well, we have to establish some ceiling. I think that's a real cause for concern. So I will leave it there, but, you know, it was very worthwhile day.
Thank you for that report, and I appreciate your attending the symposium. It's interesting that you mentioned the potential impact on the agricultural economy in the area, because just recently the governor's office put out some literature touting the economic impact in terms of jobs created by the fracking or hydraulic fracturing industry. And will be fairly interesting to me, at least, to see whether those balance out somehow. Because if there is an impact on the agricultural economy in that area, then it will change things in the lives of a lot of people.
I mean, I think at the moment, you know, the impact on the agriculture is extremely local, and it was not something I had thought of in terms of, but this, and as I say, they sort of on purpose had this physician there talking very much from this sort of first person, yet scientific experience, and the Geisinger epidemiology, public health macro picture, and then, you know, the animal research people. So, but just her talking about that was, you know, it was quite emotional.
You know, you're talking about the funding for research, long-term research on the health effects, and the lack of that funding reminds me that when we talked about glyphosate Roundup, we learned that that industry had in fact funded some research, independent research. And I'm wondering if there's been any talk, to your knowledge, about the hydraulic fracturing industry.
Well, it came up, it was brought up as just sort of an issue because on the one hand, people might be very suspicious. They'll say, you know, in the same way they're suspicious of, you know, studies on any medication when they say, oh, it's funded by the company. But then on the, as if that in itself inherently, invalidates the research, which I personally don't think it does, but, so on their point was, that even if such companies had that burden, would people then, would that be valuable? I mean, I think, if something were funded by the NIH or the Institute of Medicine or some, obviously third party, that kind of would be optimal. But, different industries do have responsibility for their products. I mean, everybody who produces something, the dairy industry, they have to prove, there are certain standards they have to do, and certainly pharmaceuticals, they have to provide samples, every lot number, every samples from every lot, every ingredient, every diluent, all of that. They bear a large expense to prove safety and efficacy, and it was just, again, it was an interesting contrast to point out in this industry, not so. Even though you could argue that on the one hand we are sort of consuming, the effects. We're consuming these chemicals. So.
Any other questions or comments? Hearing none, we'll move along to the last item under old business, the animal control ordinance. And that is on our agenda tonight because Commissioner Curley, one of our township commissioners, emailed me, and I think I shared that email with everyone on the board, raising a question about, or really raising the possibility of separating the, with regard to cats, separating the issue involving feral cats from cats that are domestic and maybe fully vaccinated, and taking that out of any requirements affecting cats in our submission of revisions to Chapter 115. And you'll recall that it's almost 2 years now since we had submitted that to the township commissioners, and our submission has yet to come to a vote. And I don't know if there's anyone on the board who wants to comment on Commissioner Curley's suggestion or what, but I'll entertain any suggestions.
The only comment I would make
Dr.
is
Humphrey.
that we posted these. We worked on, I was on the committee, we worked on this for almost a year. It's been posted for almost 2 years. And I think all we can do is make recommendations. It's up to the commissioners to pick and choose what they would want to take from our recommendations. I don't think it's fair to ask for them to ask us to revise our recommendations. We made our recommendations based on the peer-reviewed literature and the ordinances of the time. And I haven't seen anything since then to change, to warrant a change to that recommendation. So it's really in the under the purview of the commissioners to, deny the whole recommendation, pick and choose what they would like to do, or accept the entire thing. So that's just my personal comment.
Thank you. Dr. Donato?
Yeah, I just have one comment about 115 is the one recommendation we made that all the other townships in the entire state of Pennsylvania is going to be with regards to the quarantine. The 6-month quarantine is a state law. That's how that works. But everybody else is able to quarantine at home. And I would think if there's one thing that maybe we could join the rest of the entire state, thousands of townships, in that one aspect. It's a huge financial burden to people to keep, the bill for the one we heard tonight, I'm sure will be in the thousands of dollars. And if that's putting a burden on animal care facilities to manage that situation. But more importantly, again, when the state veterinarian goes around giving lectures, she says, we are saying that there's a 6-month quarantine at home, except in Radnor. She's doesn't really think that we're setting a great example and everybody should follow. She's thinking the opposite, that maybe we should join everybody else. And not that that's how we make decisions, but this is one where I think I'd love for the commissioners to really review that section, if nothing else.
Thank you. Any other comments? Well, I'm not going to ask that we vote on anything with regard to this. If I'm wrong, please correct me, but my sense is that the consensus of this board is that we respond indicating that we basically stand by our recommendations, and that it's up to the township commissioners to, as Dr. Humphrey has suggested, to either vote the whole thing up or down, or vote sections of it up or down as they deem appropriate. I think Dr. Donato's point is well taken with regard to home quarantining. As he pointed out, we just heard about an instance in which it has cost at least one Radnor resident, and we could probably think of others in the past, a considerable sum of money to follow our ordinance as opposed to what the rest of the state recommends.
But you can quarantine at home in Radnor. So does every other place have just a looser quarantine, or they don't have a home inspection? They just give people the regs and say, here's what you need to do?
They don't have them go through a process waiting for a board. They do have letters that are sent out, and depending on the type of animal involved, they may or may not have a home inspection from the state. But they are allowed to immediately have their animal in quarantine. That's where a lot of the costs and pain is coming from. And people will euthanize these cats that probably don't have rabies, but they can't handle the costs until we can meet. If it happens in July, or after our last meeting in June, then they have to wait, and it's just not a very it just doesn't seem to work anywhere else, so they've elected to not do that, and I think we should do the same.
We have that in our recommendations, don't we?
We do.
Right.
Yep.
Any other questions or comments on that? Then my belief that there's the consensus of this board, as I've expressed it, is correct, and I will follow up on that regard. Any other old business? There is one item. I guess it should have been included under old business. It's listed on our agenda as item 7, issues for 2012-2013. In the past, this board has tried to focus its efforts during each of our years from September to June on 2 or 3 health issues, and by and large that has worked out very well for us as we've addressed some of these things. And I think I asked at our last meeting that members of the board think of potential issues for this session of the board. So I'll ask at this point if anyone has come up with anything.
Well, I mean, along the lines of teen health, we had talked about the idea of this sort of the farm to school. I know we've brought it up before here, farm to school. idea about trying to get healthier options, fracking aside, healthier options to school using, and also, supporting agriculture in Pennsylvania. And, the United States Department of Agriculture, they have a whole website, like tons of resources, all kinds of stories, how lots of different schools all over the place managed to do this. And I guess, Kevin, I had, sort of wanted your thoughts about if there's any way to proceed. I mean, I realize the school must have contracts with whoever to provide, but every other school district has it as well, and yet somehow, and like I say, it is definitely something the United States Department of Agriculture is encouraging. They have part of their whole school lunch, they have a whole website just devoted to this farm to school idea, and I don't know if it's ever been discussed or sort of how we could possibly proceed with even just investigating the possibility. If you have any suggestions.
We do have, as you mentioned, our vendors already contracted for the year. So certainly I'm not familiar with where they pull their resources, or maybe they are using local produce and the like. But I can certainly forward the question on to our food services department and see if if they can certainly reach out to you if they're interested.
Is there any way we could possibly get the specifications that the district sends out to these contractors to invite bids?
Well, the specifications would be the same that the Pennsylvania Department of Health or the Department of, I guess, Agriculture requires for school lunches. So I could find that website and give it to you.
Thank you. Any other specific items?
Yeah, along these same lines, I think at the last board meeting we talked about extending some of the obesity education to the elementary and middle-aged school children. And Ms. Bushner and I just talked briefly about this before the meeting, and I think the Farm to School program is one that we would want to explore, but more broadly than that, there are other national and regional programs that are going on that maybe Radnor or the board here or the school could look at participating in. I just did a brief research on this, and there's a lot of websites that I think we should take a look at. There's a Healthier U.S. School Challenge, which involves national school lunch programs. I think we participate in that, and there's grants associated with that, looking at healthier eating for elementary, middle school, and high school children. So I think that's something that we should explore as a subcommittee. And then just more globally, I think when I think about this subject, I think part of this is similar to what's going on in healthcare nationally, and in public health. American Public Health Association has been talking about, which is communication around these topics. I think that the poster program, I think reaching out directly to older children is helpful, but just my experience as a mother for elementary-aged kids, I think that the school district is doing a lot of great things, and I think that people in their homes, parents are doing a lot of great things, PTOs are doing a lot of great things, but we're all doing them in isolation. So I think part of how we should look at maybe a project for this year is increasing the communication so that we're all reinforcing the same message at the same times. I know in my own practice working, we're looking at doing similar community medical partnerships, and one of the things that some astute college interns that we had over the summer talked about doing was some educational pieces for our patients around holidays. So, for example, in Halloween time, we would put out a communication about treats, healthy treats, not healthy treats, or around the holiday season, healthy ways to get through the holiday season, that type of thing, and then reinforce it. I'm sure the schools are doing something around that, but then being able to communicate it to parents at home so that we're all on the same page around that. So I thought that would be another way to perhaps address this situation.
Dr. Foreman?
Just an issue that's been out for a number of years, but it's still seems to be filtering through the community, and I think in the next 6 months to a year, we're going to hear some changes about it, is pertussis or whooping cough. Still very prominent in high schools, middle schools, also probably in the community that we just don't know about it because they're not checking adults. So as this school year goes on, and I think as new recommendations will be coming from government bodies on when to vaccinate people against whooping cough, it might be something that we work on in the spring again, like we did last year with Lyme disease. Explain to the community what whooping cough is in a Radnor, the television network, and that might be helpful. In addition to that, maybe thinking about some ways that possibly the students can help us come up with campaigns or something, or maybe just one of the board members, myself, maybe appearing at some of the the township fairs and talking to people about it, or presenting information about what whooping cough is and how easy it is these days to get vaccinated against it.
Well, that's an intriguing notion, and if you'd be willing, we can possibly reach out through Mr. Kane to the PTOs. I think they're always willing to entertain the notion of having speakers come and talk to them about. This would certainly be a good topic for them, so maybe we can get together on that and follow up on your suggestion. I'd like to get back to Dr. Saldivar's and certainly this is, I'm glad you've brought up the issue of the elementary school population. Would you be willing and able to chair a subcommittee of this board to look into this further and come back to us with some recommendations?
I'd be happy to.
Let me ask for some other volunteers to help you with that.
I think we were going to work on that together, so I'll volunteer.
Dr. Saldivar, Ms. Wishner, anyone else who wishes to join that, please let Dr. Saldivar know. And I'll put it on the agenda for our next board meeting, and perhaps you'll have a preliminary report ready for us. Thank you.
Just to go back to what Dr. Foreman said, just on FYI, the State Health Department has gotten federal funding to restart up the Pennsylvania chapter American Academy of Pediatrics Immunization Education Program starting January 1 for 21 months. So I hope you'll be a presenter for that program again. But so starting January 1st of 2013, pediatric and family medicine practices that want to host immunization update, including information on pertussis and information on sort of all the changes, pneumococcal vaccine, meningococcal vaccine, and also storage and handling recommendations, can get that for free with a physician presenter such as Dr. Foreman, and CME CEUs provided, and helpful handouts. So by contacting the IEP at PAAAP.org or contacting me personally, AWISHNER at PAAAP.org.
Thank you. Mindful of the restriction on our meeting tonight, the Board of Commissioners are meeting in this room, so we need to vacate the room shortly. Are there any other items for old business? Any new business items?
I was going to mention just one thing of a report I'm interested in looking at, particularly with fracking coming up. There are a lot of studies with wildlife about biomagnification of contaminants in the environment. So I think one of my goals, I just want to get my head around that and see if there's been anything reported related to fracking and biomagnification, like in the raptor species, see if we have anything there.
So would you want to follow that up with a future report to the board?
I would, yeah.
Thank you. Any other new business?
I just wondered if, Mr. Taltone, you could just comment on someone I know had asked me, said she was interested in doing a food truck in Radnor Township, which wasn't something I had thought about, so I referred her to the man who I knew would have all the answers. And so I'm just curious if you could sort of outline for the board sort of what the issues are and the procedures.
Yes, for a food truck, one of the things that you would need to have is a commissary, a commercial inspected kitchen that would have to be different from your residential kitchen. And that's a given that it's in the proper zoning area. But you'd have to have a commercial kitchen that's approved and inspected by the jurisdiction having authority. That particular person does have that. Then their mobile food vendor, their stand or their truck would also need to be inspected. They would also need to have a certified food manager certification from either ServSafe, which is from the National Register, National Food Safety Sanitation Commission, National Registry of Food Safety Professionals, or successfully passing the test from the Thompson Promisor. So they would have to have safety and food training, food safety. They would be able to go get their truck inspected and go throughout the township, but not on public property or private property. It's a growing field that a lot of people are showing interest in, to be able to have food trucks. I get requests every year of about 4 or 5 people that always want to go on private property like Villanova campus and Eastern College and different places, which I can't give them that permission. But the food trucks will have to be licensed and inspected. They have to have a commissary, because you can't prepare food in your own residence and sell it or give it away to the public unless it's licensed.
And have any of those places given permission? Because I walk through Villanova frequently. I don't know that I've ever seen it. Or, I mean, so public property, so like a kid's Little League, is that considered public property, or?
That's public property, but I would refer them to the Parks and Rec Department, because I don't think that you want to see a mobile food truck that just sets up and stays there all day. You want to make sure that that truck is licensed, that is being cleaned on a regular basis. I will say that we do have one that's currently licensed in the township. We have one that's probably going to be licensed within the next 2 weeks. But the requirements are strict. They're strict.
Is there any other new business? Hearing none and seeing no members of the public for public participation, the next meeting of this board is scheduled for Monday, November 19th, 2012 at 5 o'clock p.m. in this room, and this meeting stands adjourned. Thank you.